The gummy smile, is it common, by the way? Gummy smile? A lot of people out there with gummy smiles?
Well, it is relatively common, but you wouldn't know it by just looking at your friends or family members, because a lot of people who have gummy smile have adjusted their smile so that they don't smile as big, so that they don't show that they have a gummy smile, because it doesn't look very flattering, and it actually makes them look very immature a lot of times.
Are they self-conscious about it, by the way? Gummy smiles? I mean, when on the consult,
absolutely.
Do they confide in you?
Absolutely. Patients come in just for that, and when afterwards they're done with the procedures, when they see their natural teeth that are actually hidden away under their gum tissue all of a sudden being exposed, it's a life-altering experience for them.
They look at the mirror, and you say they get emotional.
Yes, we have had patients who right after the surgery we have handed a mirror and they have looked at their smile, their new smile with their exposed teeth, and they've started crying. We had one young lady who we did this on who was basically going to job interviews after her college, and she was being regarded as too immature.
Really?
And because she had a lot of gummy smile. And someone told her about us and the procedures we do, and she came in, and after we did the procedure, we just gave her a mirror and she looked at herself and she started crying. And then went on to get a wonderful job and became successful.
Oh, because you took care of her gummy smile?
Well, I think that just built her confidence and made her basically look more mature, and she was more confident going into this. She already had the skills and obviously the qualification for all these jobs. It was just the visual aspect that the people who were interviewing her thought she was not mature enough.
Well, she feels more confident about herself, obviously. That's going to present itself.
Absolutely, yes. Although this is not the same patient, but let me show you an example of a procedure that was done similarly.
Okay.
So this is a patient, and this patient here, as you can see in the pre-operative picture of her smile, you can see how much gum tissue she's exposing when she smiles high enough in a normal setting. This is not her laughing, this is her actually smiling, but smiling in a natural fashion. And you can see—
Do they cover their mouth even to you on the consult sometimes?
Some people do.
Or do you see them?
Some people do. I have to actually encourage the patient to smile normally or naturally before they can give us a smile like this. So they have adapted not to show this, obviously, because it's not attractive.
So her teeth appear to be just too short. But that's not the case.
No. Her teeth are— she has got her whole beauty of her teeth, and they are just hidden under the gum tissue. And so what she has is that she's got too much gum tissue.
So when you look at this on the consult, I mean, do you say, oh boy, this is going to be good?
Yes. You usually can tell based on experience, you can tell right away what the before and after, how dramatic it's going to be. There are several factors involved in having a gummy smile. Majority of patients we can just help with are very, very minimally invasive procedure that is done in the office. There's a small number of patients who may need more procedures that may be related to jaw discrepancies, but majority of patients, I would say 95% of the patients that we treat, we can help with just one procedure. When we're looking at this, the options that this patient obviously has are just to go in and just to literally remove the gum tissue.
Okay.
But the problem with that is that two things. One, if it's not done in a specific way, then it's not going to look natural and attractive to the lay eye or at a social distance to someone who is looking at her. The other aspect is that if you just remove the gum tissue and do not address the underlying foundation, which is the bone, then everything is going to rebound. We, in our office, we get a lot of patients referred to us as second opinions who have had a procedure done a year ago or 2 years ago, and everything is back where it used to be. Because
so the gums drop back down?
Yes.
Interesting.
If the procedure is not done correctly and the foundation underneath is not addressed, which is the bone, then everything will rebound. The other thing is that when this procedure is done, we follow very, if you want, artistic principles, because we look at this as far as when we scallop the gum tissue, it needs to be parallel to a line that you draw between the patient's line, the interpupillary line. And also the proportions that we try to create. We try to create teeth that are in a golden proportion. Golden proportion stems from the ancient Greek, where they found that certain things that had certain proportions to each other appeared attractive to the eye.
Okay.
And so these are the principles that we used to follow when we do these procedures.
You told me in the green room, you said, Rennie, I'm looking at her eyes. It's more than just gums.
Absolutely.
So
yes.
all of these things go into consideration.
Oh yes, because you want to create a smile that's a focus or focal point of the whole face. It's not just removing gum tissue.
Does that happen, by the way? Because you teach other dentists what you're telling me. That can happen.
Oh, absolutely, yes. There have been studies done where people have been asked what makes a person attractive. And the answer has always consistently been the eyes and the smile.
Okay.
So the smile is always a focal point of the face, and that's the way it needs to be treated.
So not all dentists are doing it the same way, the gummy smile.
No, absolutely not. If you go to a dentist who is not properly trained or has not the expertise to do this, and that's what we teach in our courses, obviously. Okay. If they don't have that experience, then they might just remove the gum tissue and not address the underlying foundation and not remove the gum tissue according to the aesthetic principles that need to be followed to make it look natural and attractive appearing.
You say your wife calls you like a perfectionist when it comes to this stuff. And even when you go home, you're still talking about it. You didn't say that, but you said she has to tell you to kind of shut down a little bit.
Yes. Well,
are you like this stuff?
When you're the perfectionist, absolutely. You have to be a perfectionist in order to do these things the way we do it. If you are a perfectionist, it's hard to shut it off when you go home. I wish I could, but
so you go home and you're talking about gum still?
Well, or
sometimes.
I'm a perfectionist in my personal life too, which I need to try to shut off.
Okay, good. So that's what you're looking for in somebody. Okay, so let's take a look at the before and after. Okay.
So if you look at her before picture,
nice.
you can see that, and then if you look at the after picture, you can see that not only do her gum tissue looks beautiful, it basically fits in her face or in her smile.
Those don't look like the same teeth. Those are the same teeth?
The teeth are the same, except the teeth have got, if you look at her before pictures, they have got a little malformation to them. They're not formed properly in the
front two
edges.
Teeth, yeah.
Yes. And so they have a little bit of bonding, but it's very, very minor. This is something that her dentist did. So just by minor bonding.
So you work together with her dentist?
Absolutely. Absolutely, yes. We do these
procedures. So you don't
procedures.
have to switch dentists to do this. If somebody has a dentist, they work together with you to do these type of procedures?
Absolutely, yes. Okay. What we do is that we go in and we work with their dentist and we make suggestions to their dentist. We'll say, you know, we fix these gummy smile issue. It would really benefit this patient if they had a little bonding on their teeth to make their teeth look even prettier.
It looks like a beautiful woman's smile.
Absolutely, yes.
Rather than just a kid. I mean, this looks like a little kid.
Yeah, and this is just a photo of her smile, but if you look at actually her smile as it frames in her face, you can see here, this is her picture before, and you can see how actually young she appears just because of that. And then this is her picture after. You can see how nicely it fits in her smile. Now she's a beautiful, attractive young lady.
Was she self-conscious about her gummy smile?
Absolutely, yes. This is something, she said, this is something I've always hated throughout my life. And by the way, the proper age to diagnose this is not necessarily when patients are 18, 19, 20, or even older. You can do it in those ages too. But if someone has a gummy smile, it manifests itself at age 14, 15.
Really?
So, and obviously at that point, then it's not going to change anymore. So we see patients a lot of times when they're age 14, 15, even referred by their orthodontists. Let me show you a second example of a similar situation, but a little different nuances here. This one, if you look at it, the gummy smile is still there. You can see the gummy smile, but it's not as obvious as in that previous
Pretty nice
patient.
smile, though. Pretty nice smile on before.
Yes, if you look at it from a lay perspective, from a social perspective, it might appear as a smile to you that's acceptable.
Okay.
But this patient really hated her smile and she didn't like it.
Okay.
Because she showed, not only did she show a lot of gum disease, but also she's got an implant here that has an infection. You can see this little bubble here on the gum tissue, which...
That's on the top right tooth?
Yes.
Okay.
She's trying to cover that with her smile, even as I'm asking her to smile larger or bigger. But wait until you see the after, and you can see how the small nuances that we do dramatically change the situation.
So what did you do for her?
Well, in this situation, her old implant, which is had an infection, we had to remove. We had to then place a new implant, and at the same time do this cosmetic gum lift or cosmetic
gum lift.
Cosmetic gum lift or cosmetic gum lengthening surgery.
Okay.
And you can see the after picture in her case, and now she has a new smile, basically, not just with the gum tissues that have been recontoured, but she's got some veneers on her teeth, and she's got a new implant with a new implant crown. And this dramatic change in her smile, although in her before picture, just like you mentioned, it might just appear as if being nuances
Well, they
or an
also look
acceptable
like short
smile.
teeth. I mean, compared to her after, I mean, huge difference.
Absolutely.